Okay. First of all, I just want to apologize. We had some technical difficulties. So good evening to everyone. Thank you so much for being with us, and welcome to the Medicaid Saves Lives rally. I am Emily Stewart. I'm the Executive Director of Community Catalyst, and this rally is being sponsored by the Community Catalyst Action Fund and Protect Our Care. Community Catalyst is one of the nation's largest health justice and advocacy organizations, and at the heart of our work is our work to be in partnership with health justice advocates across the country who every day are fighting to make sure that health is a basic right for all people. And that is why we are so thrilled to be with you this evening and to be joined by so many tremendous advocates. And we're here to talk about the Medicaid program. We're here to talk about a program that is essential to millions of people across this country. We're here to talk a program that is vital, and vital not just because it covers people's health care coverage, not just because millions of families rely on it for affordable access to the care and treatment that they need, but because it also protects people from financial security reasons, people who would otherwise be bankrupt because of a single illness or the loss of a job. But more than that, Medicaid is actually about our values as a nation. It is a tremendous force for public health, for equity, and for fairness. It reaches far beyond the individuals and families that it covers and into the very heart of who we are as a nation. And today is Medicaid's 55th birthday. It is tremendous that on this very day, the United States Congress is actively negotiating, really, as we talk to one another about the next COVID-19 relief package. And there's no better moment to talk about Medicaid and why it's so critical that Congress infuse more federal funding into the program. Because without more funding, the bottom line is that the program is going to be cut. And it's going to be cut because states won't have the money required to meet the growing demand. People are losing their jobs and they're losing their health insurance along with it. And with states facing fiscal budget crises, they're not going to be able to meet the need, and they're going to be forced to cut the program unless Congress acts. So think about this. This is going to be the last, very likely, COVID-19 response bill before what experts warn will be a fall surge. And Congress has a moral obligation to pass a package designed to support community health and well-being. And as a part of that, to specifically address the racial and economic inequities that the COVID-19 pandemic has laid bare. COVID-19 affects everyone, but it doesn't affect everyone equally. Black and brown people have borne the brunt of the health and economic crisis because of structural racism. And they will be the hardest hit if Congress doesn't act at the scale and scope that it needs to. A fundamental part of hitting the mark is investing in the Medicaid program. Every day, it serves as a source of quality coverage for people with low incomes in a country where too many people can't get an adequate wage. That's 1 in 5 Americans. It's also incredibly important for millions of people with disabilities, ensuring that they get the care and support they need for their overall health and well-being. And on that note, we want to point out that this is the week where we're also commemorating the 30th anniversary of the Americans with Disabilities Act. So it's fitting that we are honoring the rallying cry of our fierce disability rights activists. Nothing about us without us. And as the Senate debates this COVID-19 response bill, we are summoning that sentiment and the action that goes along with it. So thank you for joining us. During this rally, you are going to hear from some incredible advocates, leaders who are committed to getting into good trouble. You'll hear from dedicated advocacy partners at Protect Our Care, the Leadership Conference on Civil and Human Rights, the Planned Parenthood Action Fund, Unidos US, Little Lobbyists, and Community Change Action. You'll hear from dogged leaders in Congress, and of course, you'll hear from longtime health equity champions, Daniel Dawes and Stacey Abrams. And they're going to get us energized, and they're going to get us motivated to make our demands of the US Senate. During the next hour and a half, we will be asking you to take your place in this virtual rally by clicking the Take Action button posted on the Facebook feed and calling and emailing your senators in real time. Look, there's never been a moment like the one that we're in. It's time to rally, it's time to fight. And with that, I'll turn it over to Leslie Dock, Chair of Protect Our Care, a formidable and impactful organization and our rally co-sponsor.
Thank you. Thanks, Emily, and thank you to Community Catalyst for bringing us all together tonight for such an important cause. Emily got us off to a great start. Medicaid is extremely important. It has been since it was founded for tens and tens of millions of Americans, and it is even more important now in the midst of this epidemic that the president refuses to lead us through. I want to just give some more numbers for those who aren't as familiar with the Medicaid program to give even more life to what Emily said. 35 million children in America rely on Medicaid for their health care. There are over 7 million seniors who rely on Medicaid for their health care. Almost half of all births are paid for through Medicaid. Medicaid is particularly important to communities of color. Blacks and Hispanics rely heavily on Medicaid for their health care. 30% of Medicaid enrollees are Hispanic and 20% are Black Americans. 8.7 million Americans with disabilities are on Medicaid. And 25% of all opioid addiction treatments are paid by Medicaid. This is so important for America, and even, as I said, more important during this crisis. Since this pandemic, over 1 million Americans who've lost their job and have found themselves unable to pay their bills have turned to Medicaid for their health care. And now much of that is in jeopardy. First, through the Trump administration's Texas lawsuit. They're in court before the Supreme Court trying to overturn the Complete Affordable Care Act. And with that, threatening the 17 million people who rely on Medicaid expansion for their health care. As we speak, there's a vote on the House floor of the House of the US Representatives, where Democrats are trying to preclude the administration from spending money on this disastrous lawsuit. And as Emily also mentioned, we are in the middle of negotiations right now between the House and the Senate to make sure that Medicaid can continue to serve people during this pandemic. And that means providing more states with incentives to expand Medicaid. There are 5 million more Americans could benefit if states would simply go ahead and take advantage of this program. And millions or more are threatened, as are our rural hospitals, because for now, Republicans in the Senate and the House are unwilling to give state and local governments the money they need to continue to afford Medicaid when the demand is so great. I hope all of you will take the time during this event to click the Take Action button and make your voices heard. This week is the third anniversary of John McCain's famous thumbs down vote that blocked the repeal of the Affordable Care Act in the Senate in 2017. And it was because of action, people like all of you on this webinar tonight, that made that happen. So please exercise your voices again. Please take advantage of the technology in front of you as you watch tonight, and make sure that your voice are heard so that we can protect the millions of Americans and the millions of communities that rely on Medicaid for their health and financial security. Thank you very much.
Thank you so much, Leslie. And what a great reminder of what power of people can do. We come together and we organize and we put our calls in to Congress, and what another more important moment for us to be doing that tonight. So before we move on, I first want to take a moment to reflect on the life of civil rights legend John Lewis, Congressman John Lewis, who was put to rest today. He was a great teacher and a true believer in our ability as advocates to make what should be is. He inspired us to be hopeful and optimistic, and he always encouraged us to get into what he called good trouble. And today, in an op-ed that he wrote before his death, he encouraged us one last time. He said, when historians pick up their pens to write the story of the 21st century, let them say it was your generation who laid down the heavy burdens of hate at last, and that peace finally triumphed over violence, aggression, and war. He said, walk with the wind, brothers and sisters, and let the spirit of peace and the power of everlasting love be your guide. We thank Congressman Lewis for his unrelenting, lifelong commitment to social justice, whether it be access to the ballot box, his enduring and heroic fight for racial justice, or all the work he did to expand access to healthcare. He was a champion on many fronts, and he was in one arena where he was incredibly powerful was the arena of expanding access to healthcare. He was a huge champion for passage and protection of the Affordable Care Act, and he never stopped fighting for Medicaid expansion. Congressman Lewis, at Community Catalyst, we will always be striving to both get in and stay in good trouble. And with that, it is now my great pleasure to introduce a longtime friend of Community Catalyst and a nationally renowned scholar and leader in health equity and social justice, Daniel Dawes. He is a professor of health policy and director of the Satcher Health Leadership Institute at Morehouse School of Medicine and co-founder of the Health Equity Leadership and Exchange Network. He is also the author of a groundbreaking new book, The Political Determinants of Health, and we're so excited for you to hear from him. Daniel?
Well, thank you so much, Emily, for that very kind introduction. And thank you for that beautiful tribute for Congressman John Lewis, who has been a hero for many of us in this health equity movement. And I'm so excited to join this virtual rally and celebrate the role that Medicaid has played in elevating health equity. I have a little bit of bad news, and then I'm going to follow up with a whole bunch of good news. The bad news is that we're all living in concerning, tumultuous, and perilous times. There's no escaping that reality. Every day we as a country lose precious and irreplaceable lives to COVID-19. And I know that virtually every person you will hear from today and every person listening is doing everything that they can to stymie the spread of the virus. But I also know that it can be difficult and exhausting to search for the good in the midst of chaos. Yet that is exactly what we must do. The good news is that there is hope. And not just hope that we will turn the corner on the spread of this virus, or that we'll have a vaccine soon, but hope that rests in the fact that we as a country have overcome obstacles of this magnitude before. And more importantly, that we have tools in place that will aid us in doing so. I don't know if you all know this already or not, but I'm going to let you in on a little secret. Medicaid saves lives. The reason Medicaid saves lives is because at the very core of this great program, you will find a key tenet that should be at the core of every facet of health: equity. The fight for health equity was the driver behind the initial implementation of Medicaid. The fight for health equity is the momentum that keeps Medicaid as an invaluable tool. And the fight for health equity is going to be vital to ensuring our country has a healthy and thriving population for years to come. You see, the destiny of Medicaid and health equity are intertwined, and that is both intentional and beneficial. I say that because Medicaid is one of the greatest equity-focused health policies that we've ever been able to realize in the United States. And accomplishing such was not by happenstance. It took a deliberate and concerted effort to bring it into fruition. More specifically, it took the political determinants of health to get us here. I'm certain all of us are intimately acquainted with the concept of the social determinants of health. The social determinants of health call out and speak to many of the unintended and intended byproducts of our society that harm some of our most vulnerable and under-resourced communities. Stating that it's necessary to understand and address the social determinants of health would be a massive understatement. But a moment like the one we're all currently living through requires that we go a step further. So I want to call your attention to those upstream determinants that I've coined as the political determinants. For every social determinant that you can think of, there was a preceding political or policy decision that yielded that result. These political determinants dictate how long we will live on this earth and the quality of life that we will have on this earth. Housing issues, a zoning board made a decision. Availability of public transportation or transit, city officials had a say. Quality of education, very likely your state legislature most likely had input on the allocation of resources for your school. And I could go on and on. The point that I'm trying to make is that in order to truly effectuate change, you have to look towards the instigators of these inequities, the political decisions themselves. Actually, I have a little bit more bad news, and then I promise it's only going to be sunshine and rainbows moving forward. The bad news is that Medicaid, for all the good it brings, requires you and I to keep fighting for it, especially today. There is no denying that Medicaid elevates the health, including the mental and behavioral health of communities that need it most. And we could spend the next hour discussing what it has done to reduce health inequities in communities of color, but we cannot take for granted that it will continue to do so in perpetuity. Back to the good news, which is that if you're taking time out on a Thursday evening to attend a virtual rally centered around Medicaid, you're already enlisted in the fight for health equity. And more importantly, you're not in this alone. In this time of social upheaval, in this period of public health crisis, knowing that people before us were able to pull on the levers of government to pass and implement a health equity-driven policy that continues to greatly benefit our society should be a great motivator. It should also serve as a reminder that while political decisions may impact our health, politics has no place in access to care. If I can leave you with anything, it's this. Be proud of what we've accomplished so far, keep pushing for more equitable responses, and be persistent in addressing the political determinants of health. Thank you everyone for your unwavering commitment, your tireless advocacy, and remarkable leadership thus far.
Thank you, Daniel. And wow, what an incredible new way to think. If you haven't read The Political Determinants of Health, you've got to check it out. You've got to read it and then share it with your mom and dad, share it with your friends and your family, put it on your summer reading list. We posted a link to the book in our Facebook feed. Please do read it. This is such important work. And thank you so much for joining us. And now I'm pleased to turn it over to one of our consumer leaders, Dr. Dale Terasaki, who came to us through our partners at the Colorado Consumer Health Initiative. Dale's going to share his personal story of how a brush with illness brought him to the brink. And as he'll explain, Medicaid is what helped pull him back to safety and wellness. Dale?
Well, thanks for having me. Before I start, I just wanted to say happy anniversary to Medicaid and to my incredible wife, Kate, today. My name is Dale Terasaki, and I'm a fourth-generation Japanese-American and a third-generation doctor in my family. I work at a safety net hospital in Denver, Colorado, primarily treating addiction, and a huge majority of my patients have Medicaid. It's an essential lifeline for them, but I also wanted to share about how Medicaid was a lifeline for myself as a patient. When I was in medical school, the Affordable Care Act, also known as Obamacare, had just passed, and I was fortunate enough that I was a resident of Washington State, where the governor chose to expand Medicaid to cover people like me, a student taking on debt to pursue my career. While traveling abroad in 2013, I ended up getting a flu-like illness that turned out to be an infection. But like COVID, it was no ordinary disease. This was a bacterial infection that latched onto the inside of my heart called endocarditis. Endocarditis can lead to things like septic shock and heart failure, stroke, and other life-threatening complications. For me, the life-saving fix was open heart surgery. And luckily, I walked away with no serious complications. The hospital stay, the surgery, the cardiac rehab, the antibiotics, Medicaid had me covered. It's part of the reason I'm still here today. Currently, many of my patients also have endocarditis due to another public health calamity that did not go away with COVID-19. I'm talking about the crisis of opioid and other drug addiction. Unfortunately, heroin and methamphetamines can carry bacteria into the bloodstream when injected, leading to terrifying and costly infections. Can we prevent those from happening? Well, Medicaid covers treatments like buprenorphine, a medicine that helps my patients not feel horribly sick and crave opioids, plus overdose prevention tools like naloxone and outpatient addiction counseling that is so critical to maintaining recovery. I'm so privileged that I get the chance to be in that fight. So my experience makes me eternally grateful to Medicaid and all the advocates that push to expand it. Grassroots activists, patients, voters, health policy experts, leaders in Congress, Vice President Biden, and President Obama, thank you. But I also want people to know that funding Medicaid is not just the right thing to do, it's an investment. It helps to support some of the people who will later join the healthcare workforce to fight the current COVID pandemic, the persistent opioid crisis, and whatever else is on the horizon. Medicaid and broader health coverage in general benefits our friends, our neighbors, our safety net hospitals, and our country's future. Please stand up for this vital investment in resilient, healthy America. Thanks for your attention.
Thank you so much for sharing your story, Dale. That is an incredible story, and you are living proof of what comes when we invest in Medicaid as a country, and what that can end up doing for communities as a return on investment. So thank you for your work, for sharing your story, and everything you do to continue to advocate for this important program. And now is the moment when we ask everybody who's joining us to be a part of our advocacy. Click on the Take Action link that we have put in our Facebook event page and follow the instructions for calling or emailing your senators right now. If they don't answer, leave them a message. No matter what, before the sun goes down tonight, it's really important that they hear from you. Make sure they know that Medicaid is a priority for you, and it needs to be one for them too. So to say that we are excited about our next speaker, Congressman Bonnie Watson-Coleman, is definitely an understatement. Representative Watson-Coleman of the New Jersey's 12th District has been a firm and consistent champion for working people and improving access to care during this crisis, but certainly that is not where her work began. Definitely no, she has spent her career in Congress fighting for the principles of equity and fairness and the basic belief that all people in our country deserve access to quality, affordable health care. And so it is my great honor to introduce you to Congressman Watson-Coleman.
Hi, everybody. Thank you so much for having me. Thank you so much for having me. I'm so excited to be a part of this. This is amazing. And it's just the good work that John Lewis was dedicated to. And he asked us to continue to work. It has not been completed yet. You know, as a policymaker, we're often asked the question, does a program work? Well, we know that Medicaid works. We know that there would be people who would otherwise be unhealthy, would otherwise die prematurely, would otherwise not be able to live the kind of productive life, not be able to go to school to learn, as the learned doctor just said, not be able to support families, not be able to contribute to our society as taxpayers if they weren't healthy. Having access to healthcare, it is not a privilege that should be associated with whether or not you can pay for it. It is a right that you have, and it is an obligation that the United States of America, the government of, by, and for the people, should ensure that we have. So we know that we have to continue to fight for this. I have many friends in Congress who will always fight for the expansion of Medicaid. I know that had it not been for standing up quickly and vibrantly at the point of the current president's taking office and threatening the Affordable Care Act, had it not been for the robust demonstrations that took place, God knows where we would be today. But I tell you, this isn't of, by, and for the government. And when the people speak up, when we act collectively, we can protect Medicaid. We can ensure that those who need it. In New Jersey, we have 1 in 3 children covered by Medicaid, 1 in 8 adults, and 1 in 3 people with disabilities. This is an essential lifesaver. Do whatever we have to do collectively. Let our voices be heard. Hit that action button and call your senator. Send him or her a letter, an email. Let your senator know that it is now Enough is enough. Let us move on and take care of the people that we've been entrusted and blessed to represent. Thank you, and God bless you for all of the amazing work and leadership that you've done in this space.
Thank you so much, Congresswoman. Your story, your work, your voice on these issues is so important. And up next is an esteemed Congresswoman from the Illinois 9th Congressional District, Representative Jan Schakowsky. Representative Schakowsky has long been a champion for underserved and under-resourced communities, and her leadership on healthcare issues, including her work to champion getting the Affordable Care Act passed and then protecting it, makes her one of our very favorite allies in the House. And I would be remiss if I did not also thank you for her tremendous leadership on reproductive health, justice, and rights issues. Representative Jan Schakowsky, welcome, and thank you for being here.
Okay, I am here. Let me get the camera right here so you can see me. Thanks so much. I'm really so happy to be with you. I just came back from the funeral of John Lewis. It was amazing. But one of the things that really came through about John Lewis and his life, his early achievements, he had no pin that said he was a member of Congress. There it is. He had no particular authority. He made a decision that he was going to stand up and do the right thing because it was important for our country, for our democracy. And I want to tell you, I started out as an organizer and advocate. And in fact, in the 80s, I was the director of the State Council of Senior Citizens, the chapter in Illinois of the National Council of Senior Citizens. And at that time, some of the members, some of the leaders were actually present when the President of the United States in 1965 signed the Medicare and Medicaid Act. I mean, it was pretty amazing, that accomplishment. But since I've been here, we have seen, at least since it seems like forever, but it hasn't been because I was here when we passed the Affordable Care Act. But ever since Donald Trump took over, what we've seen is a diminution of healthcare. I can't even really understand why he is pursuing a lawsuit that would completely overturn the Affordable Care Act, Obamacare. By the way, Obama spoke beautifully at John Lewis's funeral today. There were 3 presidents there, Clinton and Bush and Barack Obama. But also to try and take away the advances that we've made. It's amazing to me that there are still states that are not expanding Medicaid coverage, 14 states. And the Kaiser Family Foundation estimated that an additional 4.4 million people would have health care right now if they had just expanded it. And let's remember, when Medicaid was expanded, it was 100% paid for by the federal government, and still the match is very big for states. In fact, in Illinois, our Illinois Medicaid expansion meant that from 29% lack of insurance in small towns and rural areas, it went down to 12% uninsurance just because they had more Medicaid. One of the most successful programs of the Lyndon Johnson era was Medicaid and Medicare. So the point I want to make to you, organizers and activists, is this really is about you. And we're your partners here in Congress. But it takes this kind of mass movement. It is no accident that we passed the Justice in Policing Act, was never on the agenda, But because people actually took to the streets, had actions in cities large and small all across this country, suddenly it came on the agenda. Organizing works, protesting works, advocating works. And that's exactly what we need right now. We are, of course, seeing every which way. We passed the ACA Enhancement Act, which is a fantastic bill that creates more opportunities for people to get health care, improves on the ACA. It is sitting on the desk in the Senate of Mitch McConnell, not calling that bill that would do so much to help so many. We have seen a dramatic increase in the number of people who are on Medicaid, thank God, since the coronavirus and since they have lost their jobs and often lost their health insurance. It is for children. And by the way, the big expansion that we've seen right now, half of it is is made up of children. And this has been such a lifesaver for so many people. And so let us work together. Let us insist that as a right in the richest country in the world, that people deserve to have health care. This should not be a question. This should not be, and I'll tell you, some of my colleagues demean people that are on Medicaid. And as I said, we're talking about children, we're talking about adults, we're talking about a bill that we had to expand how long women can stay on Medicaid after the birth of a child. In my state of Illinois, women of color are 6 times more likely to die in a pregnancy-related death than white women. We have so many issues, and Medicaid is the answer to so many. And there's one more, and that's seniors. Because much of the money for people in nursing homes right now, 70% of nursing homes are for profit, but 85% of the money comes from the federal government. We all have a stake in nursing homes. And a lot of that money is Medicaid. Medicaid is providing for previously middle-class seniors who are in nursing homes right now. It's a fabulous program. It is just one of the best, one of the gifts, one of the treasures, I should say, in our country. And it was advocacy that finally made it happen in the Lyndon Johnson administration, and we can do it again. So I'm optimistic that big changes are on the way, and in the meantime, we have to fight. We do. It's just true. We have to fight. But the good news is, when we fight, we win.
We do.
Thank
you so much, Congresswoman. You are a treasure. Thank you for your tireless efforts on behalf of people's access to health and health care. And now I'm going to turn it to a very special partner in Medicaid advocacy and a leader in civil rights and justice work, Vanessa Gonzalez, who is the Executive Vice President of Field and Membership at the Leadership Conference on Civil and Human Rights, which is the oldest, largest, and most diverse human rights coalition. She brings a powerful voice to the call for action, and as somebody who has worked with Vanessa for many years, I can tell you she too is a tireless advocate, and I'm a great admirer of hers. Vanessa?
Thank you so much, Emily. It's so good to see you and so many friends. We really appreciate it. Thank you for having us on and that wonderful detail of the leadership conference. Really appreciate it. It's really important that particularly on today when we lay to rest Congressman of our dreams and our fighter and our champion, that we continue to push and fight by standing on his shoulders and continuing his work. There is no doubt that access to healthcare is a human right. Taking away healthcare during a pandemic is just unconscionable. Like how the pandemic and the economic crisis has really laid bare the structural racism and barriers to opportunity that are entrenched in our society. Our collective actions now must not make things worse. We have to be in this together. And that includes moving to action and advocacy. Congress should be guided by the principles of prioritizing those most vulnerable individuals, families, and communities. As we just heard, it is the most vulnerable. It's our children, it's our seniors, it's our abuelas, it's the people in our community that we should be feeling the urge to take care of during this time. The most important things that we can do right now in healthcare space is to protect the coverage that we have, to protect the pathways and access to coverage, and expand access to COVID-19 testing and treatment for all persons in the United States. It is of paramount importance to ensure that all people in America are able to access the care they need to stay healthy in their homes and in their communities. It shouldn't be a question. We have to protect the Medicaid program. And that starts with your voice in calling your congressperson, calling your representative, call all the people you can, and make sure that they understand really what is at risk. It's not just a government program. It is people's lives. And we know that communities that have already been marginalized by structural barriers to equal opportunities and have low levels of wealth are particularly vulnerable during this current emergency, including Black and Brown people, Indigenous people, people with disabilities, immigrants, elderly people, and as you heard, women in particular. So the Leadership Conference on Civil and Human Rights have very grave concerns when we look at the pre-existing inequities in our healthcare system and the intersections that would allow some of these most vulnerable folks and community members to be able to actually access care. We know that all of this is being exacerbated. We know that Black and Brown people and those in the Indian country are getting sick and dying from COVID-19 at disproportionate rates due to, again, structural racism, which we continue to see perpetuated. We have to say no more. We have to support those systems which are helping to shut that down. We also know that Black and Brown people and our Indigenous brothers and sisters are also disproportionately represented in low-wage workforce that keeps our nation running. It is who we have now come to really, I hope, as a country, appreciate really are our emergency workers, our essential workers that are on the front lines, that are making sure that life for many of us who are privileged to be able to work from home, who are on our computers right now, who are able to take care and stay indoors, still have a life that is fairly safe, that allows us to stay cocooned while they are out there on the front lines. And many who are continuing to put their lives at risk are those low wage workers who do not have access to healthcare. Access to Medicaid is critically important to them, full stop. At the same time, we know that millions of people in the United States have lost their jobs for economic reasons, and often because we still have healthcare tied to jobs, they've lost their access to healthcare, and they need to be able to access that, not only for themselves, but for the health of their overall family and the communities in which they live. We know how critical Medicaid is for all of our communities. Prior to the pandemic, Medicaid was a source of coverage for 1 in 5 people in America, and today it plays that critical role in connecting individuals to testing throughout this crisis. Congress should build on the Families First Coronavirus Response Act and authorize a larger increase in the federal Medicaid assistance program. I know I'm getting a little into the weeds, but at the end of the day, what we are asking is that you please keep your neighbors, keep your brothers and sisters, your community in mind. Pick up that phone, take action, tweet, send an email, do whatever you need to do to make sure that your voice is heard, because we do need to follow in Mr. Lewis's example and make sure that we are continuing the fight, continuing to make sure that we are breaking down these structures of racial inequality that are leading to people's deaths. So thank you again on behalf of the Leadership Conference for having us here, and thank you to all of our friends. It's great to see everyone in this fight.
Thank you, Vanessa. Your love of the weeds is why I love working with you. Thank you for all of your work. On that note, it is my sincere pleasure to introduce tonight's keynote speaker, Stacey Abrams, a woman who really needs no introduction, but I'm going to do it anyway. Stacey Abrams is a nonprofit leader, entrepreneur, New York Times best-selling author, a game-changing advocate for poor and working-class people, particularly in the South. She is somebody who has been fighting for our democracy and also is a dedicated champion for healthcare consumers and a dear friend of Community Catalyst from way back. Her historic campaign for Georgia's governor's seat in 2008 gripped the nation, made her a household name, and now she's founded and is serving as the executive director of the Southern Economic Advancement Project, an organization working to broaden economic power and build a more equitable future by bringing attention to how race, class, and gender intersect in social and economic policy in the South. Stacey Abrams, thank you for joining us. We're so eager to hear from you.
Well, thank you so much for having me here today to celebrate the anniversary of Medicaid. I live, unfortunately, in one of the states that has refused to expand Medicaid, not because they don't know it works, not because it's partisan, because we've seen Democrats and Republicans expand access to Medicaid. I can only chalk it up to meanness, a meanness of spirit, a meanness of soul, and a meanness of vision. I spent this afternoon, as did so many of your speakers, at the funeral of my dear friend, my beloved hero, John Lewis. I had the honor of living in his district and being represented by him for more than a decade. But even more than that, I had the honor of calling him a friend. And when John Lewis was diagnosed with stage 4 pancreatic cancer, he knew that he would have the best healthcare available in our country, that no amount would be spared to save his life or to prolong it and to cut down on the suffering. And yet I live in a state, his state, where 2 hours from here, another rural hospital has shut down, cutting off thousands from the merest access to healthcare. In the state of Georgia, like around the country, the states that have refused to expand Medicaid have watched their doors shutter and have watched their people suffer. And that is intolerable in a nation that is as wealthy and, I know, as compassionate as the United States. What Lyndon B. Johnson pulled out of us with the advent of Medicaid, we should cling to, because it speaks to who we intend to be. President Barack Obama today in his eulogy spoke about the compassion of our nation, and that compassion is lived most expressly when we take care of one another. When our essential workers don't have to worry about a cough or a sneeze and think that, oh God, I may have COVID, but I can't be tested, and so I must be silent. When our families have to worry about whether they can make a paycheck cover food and gas, or whether it has to cover a hospital bill that could cost them their housing. We know what the answer is. We know how to solve this problem, because for 55 years, we have had a program that has said, to those who have the least, we will still have your back. The legacy of John Lewis, the legacy of Lyndon B. Johnson, the legacy we should all reach for in America is a legacy of service. One that says that your health, your ability to wake up and take care of yourself and your family, to get through your day, that your health is something we will take on collectively as a nation. In 2013, I was the newly crowned, or perhaps I just stumbled into the last room, I became the Democratic leader for the House of Representatives in Georgia. In 2010, I took on that role. In 2011, 2012, we battled against redistricting that unfortunately cut off voices from participation. And in 2013, the governor said that not only would he not expand Medicaid, he was going to deny access to the Affordable Care Act through cutting off navigators. I wondered about how I could solve that problem as Democratic leader in the minority. And so I turned to my colleagues and we did what we could, but that wasn't enough. And so I turned to Community Catalyst. Community Catalyst, along with the Nathan Cummings Foundation, helped me raise money to hire community members in the hardest hit, hardest to reach, poorest parts of Georgia, so they could understand what healthcare could look like. But the most maddening, tragic part of our work was knocking on those doors, talking to folks about signing up for the ACA, and then having to explain what the Medicaid gap was. That in a state like Georgia, where poverty runs rampant, that their community, their neighborhood would have some people who could get healthcare, but others who would be denied because Medicaid was not expanded. And I had to explain to them that they joined 500,000 Georgians in being denied access to healthcare. But not only that, we were denying the creation of 50,000 good jobs. We were denying saving our hospitals, and we were denying ourselves a thriving economy that could make our state great. I continue to fight that fight because I've had Community Catalyst by my side. And every day when I fight for the right to vote through fair fight, and I fight for the right to be counted through fair count, because our 2020 census is how we will fund the next generation of decisions that we make. I believe in the economic power of the South, and that is why I created the Southern Economic Advancement Project. And we believe in Medicaid. We believe in the promise of healthcare because we believe in the promise of people. We believe that racial equity matters, that social justice matters, and that we can do this together. Whether I was doing it as a state legislator or as a private citizen, I took action. And I'm here today to ask you to take action with us. If you're watching this, then you already know what you've got to do. And so your charge is even greater. Go find friends. Go find frenemies. Go find folks who need to be called to action, called to their better angels, called into service. This isn't about parties. This isn't about politics. This is about people. It's about the kind of people we intend to be. And if in a pandemic, we can't bring it upon ourselves to call on our leaders to pass the HEROES Act and increase the amount of money going into Medicaid, if we can't call on those who stand for office to pledge their troth to our healthcare, if we cannot call on one another to speak up for those who are too sick to speak for themselves, then what good are we? I believe in America. I'd like to call myself a patriot because I fight every day for our democracy, but our democracy is a thought experiment. It is a contract we make with one another, but it is a contract that lives and breathes based on what we are willing to do and who we are willing to be. And so I'm calling on you to go to the Take Action page, to sign up to do good work, and to make good trouble, necessary trouble, as John Lewis was so fond of saying. Because he didn't say it as an admonition, he didn't say it as a slogan, he said it as a cry from his heart, that if we get in good trouble, if we make necessary trouble, then we will trouble the waters of the world and we will churn up good that will swamp us all with its greatness and its grace. And that's what we need to look for. That's what we need to act towards. And that's who we need to be. And so I thank Community Catalyst for inviting me. I thank all of you for watching. I beg you to take action today, take action tomorrow, and by God, take action by November 3rd. Because together we can set the course of the next 55 years, where we tell the story of the greatness of the healthcare system in the United States of America, one grounded in grace and truth, one grounded in Medicaid, saying that healthcare is a human right and belongs to all of us, and that we all belong to one another, because that is truly the more perfect union. Thank you so much for having me.
Thank you so much, Stacey. Thank you for inspiring us, reminding us of not just what's right, but also what we can do together if we fight, and to reminding everybody to take action on the Take Action page. The link is on the Facebook link. Remember, before the sun goes down tonight and tomorrow and the day after that, put your calls in, send your emails, organize your friends, organize your frenemies, get everybody focused, because this is a moral issue. This is an issue about who we can be as a nation. And as Stacey was reminding us, who Congressman Lewis is telling us we can be, reminded us today in the New York Times who we could be. So thank you so much for joining us. You're such an inspiration, and we're so grateful that you joined us tonight. Okay. Next up, I'm honored to introduce somebody who doesn't need to be reminded to take action, a tremendous organizer with the Alabama chapter of the Poor People's Campaign, Callie Greer, who is a mother who was moved to action to support Medicaid and affordable care by the senseless loss of her daughter, Venus. Callie, thank you so much for being here today and telling Venus's story as well as yours.
Can you hear me?
We can hear you, yes.
Good evening. First, thank you to Community Catalyst and all of the speakers that have spoken and those that will speak on the importance of expanding Medicaid. I'm honored to be a part of this rally of love for all lives, especially people of color and low wealth people. So I'm going to share my story about Venus. It'll be cut short. I won't go into all of the details. I'll just give you what I think you need to know. Venus is my daughter. She didn't have a job. Her husband had a part-time job as a barber, so they didn't have any healthcare insurance, any coverage. And so she complained about a little knot in her breast. And so she started going to the emergency room here in Montgomery when I was living in Montgomery. I live in Selma, Alabama now. So she went in and, you know, they said, maybe your skin is allergic to something, or, you know, something like this. Gave her some little, you know, don't worry about it. Here's some pills, take these. And so she did, and she left. And that was the start of a revolving door for her because it didn't go away, and she kept going back to the emergency room saying, it's getting bigger and it's starting to hurt and it's bothering me. So, and they kept sending her back out with more pills, and until one night she went, and when the doctor walked into the room, he was like, "What's that smell?" And my daughter Venus was like, "It's my breast. It's literally rotting off." So that's when they started to help Venus. She was sent to the cancer center in Montgomery. She had radical mastectomy, radiation, and chemo. And then she went into remission for a little while, and for about 6 months. And then when she went back for her checkup, the cancer had just spread everywhere. She had spots on her liver, on her bones, everything. And she just got worse and worse. And because she didn't have any healthcare insurance, any Medicaid coverage, anything, everything she needed, even though it was in the 4th stage and had all these surgeries and was certified cancer, suffering from this cancer, breast cancer, and now other things, she had to wait weeks and almost a month or more for medications and equipment to be able to help her. So so she was waiting. She waited for like over 6 weeks for because the cancer had started in her lungs and stuff. She couldn't breathe really, and my husband used to have to tow her around the house and to the bathroom. And it was really hard on my husband because he couldn't do nothing to help our baby. She was just wasting away in front of us, and she needed the oxygen tanks, and it took them almost way over a month and a half to get them to her, and we had to be with her while she was barely able to breathe and panting and so on and so forth. And then she started getting these serious headaches, and she came over to the house one Friday and she said, "Mama, my head is hurting me so bad I can hardly see." And so we rushed her to the cancer center, and the cancer center rushed her to the emergency over to Jackson Hospital. And she was, at that time, she was waiting to be certified to have a CAT scan for her brain, for these headaches. And she'd been waiting. And when she got there, and we talked for a little while, and she lapsed into a coma. Then she got the CAT scan. And the CAT scan showed that she had 2 tumors on her brain. One had ruptured, and she was now brain dead. So she was on the breathing tank and everything, and we prayed about it that Friday night and went back and had agreed that if she couldn't breathe on her own, we was going to let her go. And we had a few words with her, and then we unplugged the breathing machine, and she was gone. I really don't wish anything like this on anybody. I don't have an enemy in my life that I would ever wish anything like this on. I do wish that people would be more informed and understand what all this really is. It's not just about my business, but all the other things that are covered and all the other issues that we have that are covered in this Medicaid expansion, and all of the things that you will be not, these little crumbs that you do have now, that you're like, okay, you won't even have those crumbs, especially Black women. I've told Venus stories many times. I've never shared that Venus is here with me all the time. She was cremated. So this is my inspiration of always looking at this in our curio when I'm in the house. And I'm just moved to say that this is too important not to do. It's about lives. humans, not color, not race, not who you're in love with, not your religious beliefs. And it's about human beings, born of a woman. If you fit in that category, it's about you. And I just don't want, I'm not gonna go in any deep, I'm not gonna take up any more time. I wanna just close with this because I'm listening, I'm watching. Ms. Abrams just blew my mind, encouraged me, gave me a little more fuel, reminding us of what that, you know, this fight is to the death. You know, we just had a hero laid to rest showing us that it's to the death. This fight is to the death. You don't retire from it. You do it until you can't or it's done. Dr. Terry Saki, am I saying his name right? Spoke about his having adequate Medicaid spend. So he's living proof of the life-saving benefits of having access to adequate medication. Medicaid coverage, I'm sorry. My Venus is also proof. Venus is proof of what happens when you don't have Medicaid spending. Thanks.
Thank you so much, Callie, for sharing your story, and so sorry for your loss. You know, it's such a reminder too of what Stacey Abrams was saying, is just the lack of Medicaid expansion does reflect a meanness in spirit. As Congressman Lewis always encourages us to do, to act out of love and hope, and together we can make sure that our values are really upheld. Thank you for joining us. Thank you for all your tremendous organizing work. We are so grateful to be in the fight with you. So thank you for joining.
All you do too. Thank you.
And now up is Jacqueline Ayers, who is with the Planned Parenthood Action Fund. Planned Parenthood does not need an introduction, and really neither does Jacqueline. Planned Parenthood serves millions of people every year, providing basic wellness checks, STI testing and treatment, cancer screenings, the full range of reproductive health care, including abortion. The majority of Planned Parenthood's patients are patients with Medicaid coverage, and it's a critically important program for our country. I'm proud to say that I have known Jacqueline for a very long time and admire her tenacity, her smarts, her strategic ability to get things done, and very grateful that she's here with us today. So I'm going to kick it to you, Jacqueline.
Thank you so much, Emily. So good to see you, and how exciting on a day where we can celebrate Medicaid. I just want to say that every speaker before has been so inspiring, and certainly loved hearing from Stacey Abrams. But I also want Callie to know you're giving us just as much inspiration by telling your story, and it matters so very much. We know that Medicaid is a foundational program. Millions of people get access to their care, and they deserve this access to the care. We want to be the country where they have access to the services that they deserve. So today, as we celebrate 55 years of the life-saving program in the midst of the COVID-19 pandemic, we have to remind ourselves just really how crucial this program is. There's over 65 million people on Medicaid, including in my own family. So I hold dear the stories of Callie and so many Black women who understand how much this program really does affect us. Groups who have been systemically barred from healthcare, women of color, young people, transgender, non-binary people are more likely to have low income and more likely to use Medicaid to get the health care they need. So unfortunately, due to structural racism, there have been too many barriers, health and economic barriers put up for Black and Latinx people in this country who do rely on Medicaid, roughly 1/3 of Black and Latinx people compared to about 15% of white people. So it's no coincidence that Black and Latinx and Indigenous people are suffering, mostly during this pandemic. We know that they are also the essential workers in low-wage jobs who are becoming infected and unfortunately dying at higher rates. Medicaid is the help that people need. It helps to serve a wide range of services, and one of the most prominent services that they provide is sexual and reproductive health care, including prenatal care, birth control, STD testing. Medicaid allows people to manage their health, to plan their future. More than half of the people that are seen at Planned Parenthood health centers in this country are relying on Medicaid to get access to the care. In general, women, and particularly women of color, make less money than men because of pay inequity, and therefore are more likely to qualify for Medicaid. For example, for every $1 a white man makes, on average, a white woman makes 79 cents. A Black woman, however, makes 63 cents, and a Latina makes 54 cents. About 1 in 5 women of reproductive age rely on Medicaid in their health care. 1 in 5, that means they're people, these are folks we know, these are our people, our communities. Women account for over half of the adult Medicaid enrollees. In fact, Medicaid covers more women's health care services than any other payer, and it is the largest payer of reproductive health care coverage, paying for nearly half of all births in the United States and 75% of publicly funded family planning services. So at its core, we should remember that Medicaid is a women's health care program, and because of wonderful advocates like Emily and the long work that she has been able to do, we know that we really have to help people understand when we're talking about Medicaid, Medicaid is a women's health program. As we continue to face this dual public health crises of COVID-19 and systemic racism, more and more people are going to need Medicaid in order to get access to essential care services. And yet, unfortunately, the Senate majority's recent proposal does nothing to help more than 5 million people who have lost health insurance to expand Medicaid coverage. And meanwhile, 13 states have still refused to expand Medicaid, leaving millions without health insurance. And this is just not acceptable. It's during unprecedented times like these where access to healthcare coverage through Medicaid is essential. It's for our healthcare. Medicaid is helping to save lives, and it is key to ensuring people are able to, in this moment, endure a financial crisis and make sure that the economy can fully recover. We can do that by investing in Medicaid, and now more than ever, it's really critical to protect all of us. We work to advance racial equity in this country and ensure that we can protect access to reproductive health care. This is an issue that simply cannot wait, and thank you so much for having Planned Parenthood Action Fund join you tonight.
Thank you so much, Jacqueline. It's always so good to see you, and you always do such a great job of painting the full picture of what is at stake, and we really appreciate it. Jacqueline is reminding us all of us about how important it is for us to be making our calls, sending our emails, organizing our friends, our frenemies to advocate on behalf of Medicaid and make sure Congress in this COVID-19 relief package funds the program so that people can keep getting the coverage that they need. Our next speaker is a staple in community catalyst events and really anywhere where health and healthcare issues are being discussed. Elena Hung is the executive director and co-founder of Little Lobbyists, a family-led organization that advocates for children with complex medical needs and disabilities. She has a long list of accomplishments, including a huge advocate on Capitol Hill. She became really famous during the defense of the Affordable Care Act, and she is a columnist who has had her work represented in the New York Times, Huffington Post, Vox, but her most important role is that of mom to Xiomara. Elena, thank you so much for sharing your family story and for talking to us today about why this program is so important.
Thank you, Emily. Hello, everyone. Thank you so much for joining us to commemorate this special anniversary. Happy 55th birthday, Medicaid. I am so thrilled to have the opportunity to share some of my personal thoughts about what Medicaid means to me and my family. 6 years ago, I had a great pregnancy and an amazing birth. And then 15 minutes after my baby was born, she was placed on 100% oxygen support and rushed to the neonatal intensive care unit, where she remained for the next 5 months. She was diagnosed with serious medical conditions affecting her airway, lungs, heart, and kidneys. I named my daughter Xiomara, which means ready for battle, and she is definitely that. She is the joy of my life, and I am so lucky that I get to be her mom. I'm thrilled to tell you that Xiomara is thriving today. She is happy, kind, funny, clever, a little bit naughty. Xiomara graduated from kindergarten recently, last month, and celebrated her 6th birthday earlier this month. 2 milestones that were never guaranteed and that I am forever grateful for. And I am so grateful to Medicaid for making that happen, making that possible. Xiomara uses a tracheostomy to breathe, a ventilator for additional respiratory support, a feeding tube for all of her nutrition, and a wheelchair to get around and explore the world around her. Medicaid paid for these therapies: physical therapy, occupational therapy, speech therapy, and feeding therapy, as well as the home nursing care that helps support Xiomara's independence and her ability to live at home and in the community. It has been literally a lifesaver for us and families like mine, and that is what led me to co-found my organization, Little Lobbyists, a family-led group that advocates for children with complex medical needs and disabilities. We are committed to protecting and expanding Medicaid so that disabled children like ours, like mine, and the disabled adults that they will one day grow up to become can live a great quality of life as a result of the home and community-based services and long-term supports and services that's paid for by Medicaid. Medicaid can literally be the difference between life and death for so many families, especially Black and Brown and Indigenous families who are disproportionately impacted, and especially so during this global pandemic. So as we commemorate this special anniversary, I invite all of you to a call to action, to call your members of Congress to demand that they fund Medicaid, to fund the home and community-based services so that we can live at home and not in institutions far, far away from our loved ones, to fund the programs that help children like Xiomara live their best lives. So thank you. Thank you so much. Thank you to Community Catalyst. You know, you're so, so dear to my heart. It has been a privilege to join all of you tonight, and I wish you all good health.
Thank you so much, Elena. Thank you for your work. It is such an honor to be able to partner with you on this really critical fight. Next up is Julie Riskin, who is a consumer advocate, leads the Colorado Cross Disability Coalition, and came to us through our partners at Community Change Action. She's here today to share her story about how critical Medicaid is to individuals and families. Thank you, Julie, for joining us. We look forward to hearing from you.
Hello, can you hear me? Thank you so much. My name is Julie Riskin, and I am the Executive Director of the Colorado Cross Disability Coalition, and we are a proud participant in the Community Change Income Support and Safety Net cohort. I was diagnosed with multiple sclerosis in the 80s when I was in my early 20s. And I believed what most suburban white people believe, that if I did the right thing, I would be okay. The right thing, in my opinion, was to increase my earning capacity, so I pursued a master's degree. After graduation, I wanted to change jobs and try out my new skills. In those days, that made me forever uninsurable because I had a pre-existing condition. This was years before the Affordable Care Act. But still, I figured I could just work hard and earn enough to buy what I needed without insurance. I was successful at work, but it was not enough. It never is. People with significant disabilities need to be extremely wealthy to cover all of our healthcare costs. My doctors actually refused to work with me if I did not get on Medicaid, because that is the only option. I finally relented, but with a lot of anguish and shame, because middle-class white girls from New England don't end up on Medicaid, right? That started a journey into poverty that lasted more than 20 years until we were successful in getting a Medicaid buy-in for working adults with disabilities in Colorado. I was angry that I had to become poor just to get health care I needed because of the income and asset limits connected with Medicaid. I joined with my disabled brothers and sisters and others fighting for more equitable health care and safety net services. States cannot do this without federal support. Colorado Senators Bennett and Gardner, you promised in a letter to support an increase to Medicaid during this pandemic, and we need you to keep your promises. Anyone that does not support Medicaid does not support the right to life or the right to liberty. These are supposed to be inalienable rights in our Constitution. For me and countless others you've heard from tonight, Medicaid is the key to our right to stay alive and to live freely. We know people living and working in institutions are dying much too fast of COVID-19. Why then does the Senate bill not provide funds for Medicaid community-based services, but instead allow operators of congregate facilities for profit to have unlimited profits with no accountability? Medicaid has helped me, and it needs to be there for every person in our borders. It needs to be there for people like Ms. Greer's daughter. That was a murder in my book, What Happened to Her. Expanding and strengthening Medicaid is one way to start to address the historical and deadly inequities, including, but certainly not limited to COVID-19, that hurt everyone, but hurt especially low-income communities of color. Medicaid provides better, more efficient health care without the ridiculous and cruel limits and excessive out-of-pocket costs that private insurance imposes. The principles on which our country was founded cannot work without Medicaid and other safety net programs. So let's keep up our action, our noise, our good trouble, and demand that every single United States Senator do their job, do it today, and get Medicaid funded in this package. That's the happy birthday present that Medicaid need and our country need, and we need it now. Thank you so much.
Thank you so much for joining us, Julie, and for reminding us to take action. Folks, you can click on the Take Action link being shared again in the feed. Now is the time to call or email your senators, make sure they know that Medicaid is a priority, that they have got to fund this program. They have got to fund it in line with the House-passed HEROES Act. Julie is reminding us of what a critical program this is, and so please click. So another champion in the advocacy space, an organization that has worked long and hard to bring voice to underrepresented people, is Unidos US, which was actually founded just 3 years after the creation of the Medicaid program, and it remains a national research, policy, and advocacy organization providing a public and coordinated voice for Latinos all across the country. We are thrilled to be joined by Alberto Gonzalez, who is a senior health policy strategist at Unidos and a former Community Catalyst team member. So thank you so much for joining us, and take it away.
Thank you, Emily, and thank you so much, Community Catalyst, for having Unidos US be part of today's rally to celebrate Medicaid's 55th anniversary. Unidos US, formerly known as the National Council La Raza, is the nation's largest Latino civil rights and advocacy organization, working to increase opportunities for the nation's nearly 60 million Hispanics. And by leveraging our unique assets of policy and programs in the areas of education, immigration, economic empowerment, and housing and health, along with our affiliate network of nearly 300 community-based organizations in 37 states, DC, and Puerto Rico, we seek to achieve transformational change that will build a stronger, more equitable America for all. Our health is our greatest asset, and everyone should have the opportunity to achieve the highest level of health possible. Despite the historic progress we've made over the years, Latinos remain one of the most uninsured communities in the country. Before the pandemic, an estimated 19% of Latinos were uninsured, compared to around 6% of non-Hispanic whites. And findings from our recent report on Latino children's coverage, in partnership with Georgetown University's Center for Children and Families, show that after a decade of progress, the Latino child uninsured rate increased to 8.1% compared to 4.2% for non-Latino children in 2018. And that is why Unidos US continues to champion policies and programs like the Affordable Care Act and Medicaid that give more people access to health coverage. Medicaid is an important lifeline for millions of Americans and plays a particularly important role for Latinos. Of the more than 70 million Americans who get their insurance under Medicaid, 18 million are Latino. And when it comes to Latino children, around half of the nation's Latino children get their coverage through Medicaid or CHIP. So clearly, protecting and strengthening Medicaid has important health equity implications for the Latino community. And that is why Unidos US and our affiliates have been staunch advocates for protecting, strengthening, and expanding Medicaid, given the role the program plays in our community. Like many of you, we fought against multiple attempts to repeal the ACA and fundamentally change and cut Medicaid. We pushed to expand Medicaid. According to some estimates, around 3 million low-income adults gain access to health coverage through their state's adoption of Medicaid expansion. And we've been particularly active in Texas and Florida, given that approximately 520,000 Latinos could gain access to coverage under expansion. And as the pandemic and the economic crisis continue to unfold, we need bold investments in Medicaid now to support working families, including Latino and mixed status families. Latinos are on the front lines making vital contributions to our country's ability to function. Despite having one of the highest workforce participation rates, Latinos tend to work in industries least likely to offer employer-sponsored insurance. And that is why public coverage programs like Medicaid are even more important for the Latino community. Our community is overrepresented among the uninsured and in frontline jobs considered essential in the pandemic. That makes them most vulnerable to getting sick and dying. As of July 1st, Latinos make up 35% of all COVID cases, but only 18.5% of the total US population. Latinos, particularly children, continue to experience health disparities, higher insured rates, and positive COVID cases. We need to ensure that all who need access to COVID testing, treatment, and care can receive it. And that is why we ask that you call on Congress to make critical investments in Medicaid in the next COVID package. Doing so will give us the greatest chance of controlling this pandemic and lay the groundwork for an overall healthier America. We have the opportunity now to strengthen the program to address the immediate healthcare needs of our community during this unprecedented crisis. And Unidos US opposes the recently introduced HEALS Act as it does little to nothing to provide the level of comprehensive and inclusive public health response that Latinos and other communities of color need. You can learn more about Unidos US's priorities and work at unidosus.org or follow us on Twitter, Instagram, and Facebook at We Are Unidos US. All people in this country deserve the opportunity to live a healthy life. Unless Congress takes immediate, robust actions on Medicaid, COVID-19 will further exacerbate Latino health disparities for years to come. Thank you, Emily.
Thank you so much, Alberto, and thank you for Unidos US for all the work that you all do to fight for people's health and well-being. And at this point, I do want to remind viewers that you can find the website links for all of our partner groups, including Unidos US, in the timeline. Check out their work generally, sign up for their emails, get involved in their organizations. It's really important that all of our partners here today are getting your energy and your attention, because we are certainly in this fight together. And as you all know, we've been talking a lot about the Senate tonight. This is the place where this fight is happening. As we have reflected on, the House of Representatives actually passed their bill a couple of months ago, the HEROES Act, which includes the funding that we need for the Medicaid program in order for it to stay strong and to get people the coverage and care they need. And the battle now is in the Senate. That's why we are pushing on folks to make sure that they are organizing their friends and their families, putting those calls in, sending those emails. And so, because of that, some of our senators are busy fighting as we speak. And so up next is Senator Hassan, who actually, because she couldn't join us, instead gave us a video for us to watch. She wanted to make sure that we knew that she was real time fighting with us. And with that, we're gonna move to the video.
Hello, I'm Senator Maggie Hassan from New Hampshire. Thank you to Community Catalyst for hosting this virtual Medicaid Saves Lives rally. As we commemorate the 55th anniversary of Medicaid, we need to remember the critical difference it has made, while also reaffirming our commitment to protecting it. Medicaid has delivered countless benefits and opportunities to people from all walks of life. Medicaid helps seniors and those who experience disabilities receive supports that allow them to live independently in their homes and in their communities. It also helps countless children who experience disabilities go to school, and it assists school districts in covering the costs of medical care and equipment necessary to facilitate special education services. New Hampshire's bipartisan Medicaid expansion plan has provided more than 50,000 hardworking Granite Staters with the peace of mind that comes with quality, affordable health insurance. And the COVID-19 pandemic has underscored why that access to care is so critical. On this anniversary, we must recommit to strengthening Medicaid during this pandemic and for generations to come, while also standing firm against those who seek to undermine it. Over the last several years, we've seen repeated efforts in Congress that would drastically cut this vital program and sabotage our healthcare system. I've been proud to work with advocates like all of you in the face of these attacks, and I am so grateful for your efforts. We must continue to stay vigilant, particularly given the public health emergency that our country continues to face. I urge you all to keep up the great work, and please stay safe. Thank you.
All right. Thank you, Senator Hassan. And in a similar boat is Senator Bob Casey, who is also, as we speak, fighting the good fight. And we are hearing certainly from their offices that they need to continue to be hearing from folks that this is a big priority. And so because Senator Casey is fighting alongside Senator Hassan, as we are organizing ourselves on this end, he also submitted a video because he wanted to make sure that we heard from him and that we knew how important it is that we are taking action. And with that, we'll kick to a video from Senator Casey.
I want to thank Community Catalysts and Protect Our Care, as well as our other partners, for hosting this Medicaid Saves Lives rally. You know, Medicaid is a program that reflects our values as Americans. It also reflects whom we value as Americans, like children who need health care, who live in small towns and rural areas, big cities, and everywhere in between. We also care a lot about folks with disabilities who would not have care any other way absent the Medicaid program. And we certainly value our seniors, those who have done so much for us in this country, who need skilled care. So Medicaid is a program that reflects basic American values. Now there's some in Washington who want to cut Medicaid. Every year they talk about cutting it, not by a couple $100 billion. One year recently they proposed cutting Medicaid itself by $1 trillion over 10 years. $1 trillion cut to Medicaid by some in Washington. Thank goodness it didn't happen, but they will try and try again to cut the Medicaid program. Are we better off when Medicaid is slashed? We're less secure as a country when that happens. These same people in Washington wanted to end, not cut, end Medicaid expansion. Medicaid expansion that provided health care for the first time to more than 12 million Americans. Some people believe the number is even higher than that. That's the low number I've heard. So both actions, whether cutting Medicaid by hundreds of billions of dollars over 10 years or ending the Medicaid expansion effort that was undertaken through the Affordable Care Act, both of these actions would hurt the most vulnerable in small towns and cities and in rural America. That's not who we are as Americans. That doesn't reflect American values that we say we stand for. That's not who we are. We believe that a child should receive early screening and diagnoses and testing so they can get better and so they can be prepared for life. We believe as Americans that older Americans should have skilled care in the twilight of their lives. That's who we are. We care about these folks, and we're going to fight like hell for them. And that's what we're going to continue to do together, to fight cuts to the Medicaid program, to fight efforts to end Medicaid expansion, efforts that Republicans have undertaken to try to declare unconstitutional the Patient Protection and Affordable Care Act. We're not going to let them do that. We're going to fight them every step of the way. And we should also make sure that states have more help, especially at this time of economic crisis driven by a worldwide pandemic. We've got to make sure that states have more matching dollars from the federal government. I got a bill to do that, that will tie the matching dollar amount to the unemployment rate of a state, the economic conditions in a state. That's fair, it makes sense, and it will meet a great need that states have right now for matching dollars under Medicaid. My bill is Senate Bill 4108. 4108, which would do the right thing going forward on Medicaid. So you bet Medicaid saves lives. It's who we are as Americans. Let's keep fighting to protect Medicaid. Thank you, and God bless your work.
Thank you, Senator Casey, and thanks to all of our speakers in tonight's rally. I want to take this moment to one last time remind everybody to take action. We've got to contact our senators. We've got to put in those calls, those emails. We've got to organize our friends and our frenemies. This was a great rally. I think this was a tremendous representation of why this program is so important and why we have got to fund it. We heard about how the destiny of Medicaid is intertwined with the destiny of health equity and racial justice. We've heard about the political determinants of health and how our political system is what drives the inequities and the injustice in our country, and also that we can fix it, that if we work together and we fight hard, we can change it and get this program and more programs there for everyone who needs it. We have heard personal stories about the impact of accessing Medicaid, what that can do for people, and the heartbreak that can happen when it's not there for the people who need it most. We have talked about how Medicaid is important for so many people, for seniors, for children, for people with disabilities, for women, for LGBTQ plus people. And we've talked about how it's especially important for Black and Brown people because of the unfair and discriminatory barriers that they face to economic security due to structural racism. We have heard from members of Congress, we have heard from nationally recognized thought leaders, and we have heard from grassroots organizers, people who spend day in, day out fighting the good fight, getting into good trouble. We have reminded ourselves of what Congressman Lewis has always called on us and continues to call on us to do in terms of fighting for what is right and just in this world, and fighting for it in a way that embraces hope and optimism, where we believe that we can make the change that we seek in the world. And because of that, we have got to stay organizing, stay making those calls, stay doing our virtual rallies until we can see each other in person. And I want to thank you all for doing that. We look forward to continuing the fight with you. Thank you.